Good afternoon, everyone. Dr. El Sayed here with another update on the COVID-19 situation. As we said last time, the situation is very fluid. Things are developing at a relatively rapid pace. Before I delve into the update, just want to share with you why I'm doing these updates as frequently as I can. As I'm sure you're aware, there's a lot of information, a lot of misinformation out there, news reports coming right and left, and it can be overwhelming. It's overwhelming for us as physicians and healthcare workers because this is a new situation, a new experience for all of us. So it must be also very overwhelming for all of you who are not in the healthcare field. And our duty as physicians is not just to treat patients, but it's also to educate the community and the public at large, and to help you sift through the information and the misinformation. And I must say, everyone has a role to play, not just as us as physicians. And as I was driving to my office this afternoon, it's lunch hour, and I was surprised. My office is in Potomac Falls, in Sterling, Virginia, and the roads are always very busy, and they were almost empty. It's as if I was driving at 5 a.m. And that's indicating that everyone, or a lot more people, are taking this seriously, and that's very good. So let's get into the update. Nationwide, according to the CDC, we've got about 33,404 cases, which is more than double than the cases that we had with our last update 3 days ago, and 400 deaths. Now, there are some reports of more than 35,000 cases with nearly 470 deaths. You take the numbers with a grain of salt. The issue here and the important thing is that there's an increase in the numbers. The U.S. now has the third largest number of cases worldwide. In Virginia, so locally looking at the DMV area, we've got 219 cases with 3 deaths. In Maryland, 288 cases with 3 deaths. And in D.C., 116 cases with 2 deaths. Now, the surge in the number of cases is most likely related to the increasing testing availability. So we're going to see quite a jump in the number of diagnoses. And further developments, as of Friday, as we discussed, California and New York had issued stay-at-home orders. Now those have been extended to other states, including Louisiana, New Jersey, Delaware, Connecticut, and Illinois. And other states have closed bars and restaurants except for delivery. And we shouldn't be surprised if this comes down in our area. Now, one issue that's very important is that there is a severe shortage of personal protective equipment, and that's putting healthcare workers in danger. And what I'm talking about are the face masks, the gowns, the eye protection for the frontline workers. In some cases, these healthcare workers have been instructed to reuse their face masks, which is really unheard of, especially with something that's very contagious. Now, even the CDC guidelines are saying things which I consider ridiculous, that they may use bandanas or scarves when the face masks are not available. So this is a very, very serious situation. Several physicians have been hospitalized and they're in the ICU because of the infection. So really, unless you are sick and manifesting symptoms, you don't need to wear a mask. If you have any personal protective equipment that you bought just in case, please consider donating it to a hospital. Now, one point I want to focus on today is treatment. There's been a lot of discussion in the news and the media about potential treatment. So let's start from the beginning. Again, the most common symptoms: fever, cough, shortness of breath. Less than 10 to 15% will manifest with sore throat, some URI symptoms, etc. In mild cases, remember, this is a viral illness. In mild cases, the treatment is self-quarantine and symptomatic management. So you manage the fevers, you manage the cough, drink lots of fluids, and stay home so you don't infect others. There was a question raised about using ibuprofen and other NSAIDs, the non-steroidal, so ibuprofen, naproxen, and those kinds of things, because there was maybe a study or so that came out saying that it might make this COVID-19 infection worse. So here's what I have to say about this, and several physicians agree with what I'm saying here. If you chronically take NSAIDs anyway for other conditions, now is not the time to stop taking them. If you don't typically take them and you need something because you've got a fever and your symptoms are related or potentially related to COVID-19. So we have fever, you have aches, etc. Then try to start with Tylenol or acetaminophen. Unless obviously you have a contraindication, you've got liver disease, or for whatever reason you can't take them. The bottom line is the jury is out on ibuprofen and NSAIDs. So if you still need them, if you're taking Tylenol, you're taking acetaminophen, but you still have a fever, you still have body aches, go ahead and take ibuprofen or any of the other NSAIDs until we have definitive studies. So what about actual treatment for COVID-19? Because at the end of the day, this is what we want. If you've got the infection, can we treat you? So currently, the bottom line is currently there are no FDA-approved drugs. Now, there are trials, there are investigations going on. So there are some medications you may have heard about in the news. President Trump mentioned a couple of those medications. Chloroquine. Chloroquine's a medication that's been around forever. It's an anti-malarial that's used to treat malaria, which is spread by mosquitoes, widespread in Africa. There's speculation that because it's widespread in Africa, that's the reason that there's been a low incidence of COVID-19 in Africa. Could also be because we're not doing much testing out there, because of the poor healthcare infrastructure there. However, the medication has been shown to have activity against the virus. Hydroxychloroquine is another medication known as Plaquenil. It's widely used in the U.S. for treatment of autoimmune diseases such as rheumatoid arthritis and lupus. Now, some studies have shown promising results in treating confirmed hospitalized cases of COVID-19. Now, there are some ongoing investigational use combining it with the antibiotic known as azithromycin. You may know it more as Zithromax or the Z-Pak. Now, I want to take a moment here and explain something very, very important. As I'm sure you're aware, long before this COVID-19 came about, anytime you went to the doctor and you had common cold symptoms or you had the flu, or you had any viral illness, and you were hopeful that your doctor would prescribe antibiotics, I'm sure you heard your doctor say, yes, you've got an illness, it's a viral illness, it'll probably take a week or two and you'll get better, but antibiotics are not appropriate treatments. So you may be wondering, why is an antibiotic being used if COVID-19 is a viral infection? And that's a very appropriate question. So here's my take on that. Number one, these are hospitalized patients. So these are patients, remember, fever, cough, shortness of breath. These are patients who typically will develop bilateral pneumonia, meaning pneumonia in both lungs. They are severely short of breath. Many of them are requiring respiratory support, which means at the very least oxygen. Sometimes they are intubated, meaning that they need artificial breathing support. So when there's pneumonia, you're going to be treating with antibiotics. That's number one. Number two, Zithromax, azithromycin, has been known for a very long time to have anti-inflammatory factors. So it has been shown to be used as an anti-inflammatory medication. And we know that with COVID-19, there's a significant inflammatory process that is going on. So there is the potential here that azithromycin, as an antibiotic, is being used here because of its anti-inflammatory impact on the infection. The big thing that I want to emphasize, and I want everyone to understand, is that there is a significant potential side effect profile significantly affecting cardiac, the heart, when you combine hydroxychloroquine and azithromycin. So this is not the time to start running to your doctor and asking for prescriptions of Plaquenil and azithromycin just in case you develop an infection. There's no recommendation to take these medications prophylactically, meaning just in case you develop the infection. These medications are being used right now for confirmed cases, patients who are actually hospitalized, and they are being monitored. Other medications that were investigated, Kaletra is an antiviral, which is known and used to treat HIV. There was a study done in China which actually failed to show any benefit, but it still continues to be under investigation. Another medication that's being actively investigated here in the U.S., remdesivir. It's an IV medication, and it's being used in hospitalized confirmed cases. Now, why am I talking about medications in all this detail? Because I want everyone to understand that even though we're saying it's a viral medication, viral infection, even though we're saying that we don't have vaccines, even though we're saying that there's no known treatment, there's constant active movement in the medical world to try and deal with this rapidly spreading infection. So healthcare workers are working 24/7, not only to treat patients, but also to try and find potentially a successful treatment. But we all have a role to play as well in the meantime. So I want to remind everyone of some of the current recommendations and advice. And we discussed these in detail in our last update. I'm not going to discuss them in detail again. Social distancing, frequent hand washing cannot be overstated. Those are the number one things that we can all do if we want to flatten that curve. For those over the age of 65 years, those with chronic medical conditions, those who are immune compromised, please stay home. You're the highest risk group that may deal with this infection and its complications. Everyone else, stay home as much as possible. Work from home if you can, because you can have a prolonged period where you're carrying and shedding the virus, spreading it to other people, and have absolutely no symptoms. In my last update, I addressed in detail what to do if you have symptoms and you're concerned about them. If you want more information, please watch that video if you haven't already, or if you have concerns. Finally, try to take advantage of alternative options for accessing medical care, such as telemedicine. That's where you communicate with your doctor through video and phone, so you don't have to go to the office and be seen and potentially be exposed to those who are infected or expose others if you're carrying the virus and you don't know. As I mentioned last time, here at Al Sayed Primary Care, we transitioned all our care for our members to virtual medicine, telemedicine visits. And I'm also proud to announce that we are now launching telemedicine services to non-members as well to help with access to medical care. So if you're interested, if you're not a member, of course, we'd encourage all those who are interested to join and become members, because telemedicine services to our members are included at no charge. But if you're just interested because you have some symptoms you're concerned about, or any healthcare issues and you're unable to reach a doctor, or you don't have a primary care physician, just go to our website, alsayedprimarycare.com, and details will be there. As always, stay informed, avoid panic and unwarranted fear, and be sure to keep an eye on our page as we do our best to update you on the latest. Thank you very much for tuning in.